everyone, it's Joanne here. I'm going to make a quick video for you on venipuncture. I'm going to show you two different techniques in this video. One is going to be with a straight draw, and it can be either single sample or multi-sample. And as well, then I'm going to show you the butterfly draw. Now, we're not going to do the butterfly draw in lab, so this is your opportunity to see how that device works. Okay, so for the purposes of the video, we don't have a doctor's order. I don't have an armband on the patient. I'm just taking tubes to draw. It's not about the test and all this. This video is more about the mechanics of the actual draw. In lab, we will stress the tubes and the tests and your responsibility as a nurse. But I just want to keep this as kind of tight and short as I can. I'm going to show you this called the order of the draw. It shows you the order that the tubes, for the visual person who likes to see the tubes, in what order they should be drawn. We're going to work on this and stress on this in lab, but just know as a nurse that it's your responsibility to know what tube to use, what additive is in the tube, what pre-procedure requirements are done or you need to be aware of before the blood is drawn, what is required after the blood is drawn. You have to maintain the integrity of the specimen, so therefore you have to understand. And if you don't understand and you draw the wrong tube or don't prepare the tube right or do something or miss something, the only person that kind of ends up getting hurt in that is the patient doesn't get an accurate result and they may need to be retested. So that's why we're stressing it's your responsibility as the nurse to know what you're doing. Okay, with that being said, I'm going to show you your equipment. So we're going to assume here in the video that the patient has consented, they're knowledgeable, they're positioned, they're comfortable, the nurse knows, I know what tests I'm drawing, what I'm doing, what it's for. So all that we're going to assume is done. I've washed my hands already and I'm going to wear gloves with the blood draw. I will show you the equipment first as to what I'm going to do. So a tourniquet, that's a bit of a trick getting that on, but you'll practice that in lab. This is the straight draw, this is the needle. And this is the vacutainer holder. Get that so you can kind of see it. And what I'm going to do is this unit needs to kind of, sometimes they come put together, sometimes they don't. This is a one use only. So if you're going to use this on Bob, you are not going to use it on Donald. So you use it one time, throw it out. In lab, however, because we have limited supplies, we may reuse this over and over and over for you to practice drawing. But in a clinical setting, one vacutainer per person. Okay, so I'm going to take off, there's a little safety cap here, so I'm going to take off the other end because the safety cap kind of is telling me where the needle is. Okay, so I'm going to discard of that and I'm just going to put those two together. They just screw together. Okay, now it's all one unit. The blood tube is going to fit in here and I'm just going to pull back the safety and my needle's under there, so I'm not going to take the green cover off just yet. Okay. I'm going to apply the tourniquet 4 to 6 inches above the intended site. Now most draws are done in the antecubital fossa, so I'm going to pull tight and I'm going to do a quick release. You guys will work on this and it'll take you a bit to get it. Tourniquet can be on for no longer than a minute. So this gives me an opportunity. I realize I'm still barehanded at this point, but I may palpate around and try to decide where it is that I want to get the blood from. So it should feel kind of somewhat bouncy. It shouldn't feel hard or cord-like. And I'm going to identify that this is the vein that I'm going to draw the blood from. So I'm going to remove that tourniquet now because I know where I want to go. So I'm going to release that and I'm going to apply my gloves. Okay, so I am going to, let's say for the purposes of the video, I'm going to draw 3. So again, I know what these are, and you need to know what these are and what order that they go in, but for the video, we're not going to get into that. I'll have them in the right order. I have an alcohol swab to clean. I have a gauze to put on when I'm done. I have my vacutainer holder. I have my labels, and I'll demonstrate how to label the tubes when we're done. I think we're good to go. So I'm going to clean my site first. Take that. And I'm going to clean with alcohol. or chlorhexidine or whatever your institution is using in their policy and procedure. Okay, So I'm going to clean that site and allow it to air dry. Okay, so I am not going to retouch that site. If I retouch it, I need to re-clean it. So I'm going to reapply the tourniquet. The tourniquet can be on for a minute. Now if I'm talking, it might be on longer, but if the patient does this and has the tourniquet on, it can change the components that are in the sample, which will give you an altered result. So just have the patient make one fist and hold it. Okay? Pick up your Vacutainer holder. Now, I don't know, I'll put that against my white coat. You might be able to see the bevel there, but it's bevel up, okay, for the blood draw. I'm going to hold the site taut, like pull back with my thumb to keep the vein a little bit taut. It's a little bit easier to get into. I'm holding it in my dominant hand and my tubes are sitting here lined up. You can just sit them in there if you feel that you can maneuver that, or you can engage them whenever you feel you're in the vein. Okay, so he knows I'm going. I'm just going to poke on 3. It's just be a small little poke here. 1, 2, 3. Bevel in. I don't put the whole needle in. See where I kind of stopped? I'm bevel in and a little bit more. I feel like I'm in the vein. So I'm going to switch hands now. I'm going to take this hand and hold the Vacutainer holder solid. Now my thumb is sitting right on his hand and I'm just pinching it, okay? So this unit is not going to move. Pick up my first tube and I'm going to use the wings. There's little wings on the side here and I'm going to puncture that first tube on. And see how the blood's coming? So it works on a suction, so it'll take out, evacuate whatever blood it needs, and then when the suction stops, that's when the blood draw is done. So I'm going to pull off and push off with my thumb, push, and I'm going to invert the tube the proper number of times. Okay, I'm going to sit it down, and I'm going to do the same thing. Now I don't want to push the tube on, and I don't want to pull the tube off because it gives more chance that this may disengage. So once I establish the flow of blood, I can remove the tourniquet. Okay, we don't leave the tourniquet on for the whole time. Remember, it's only good for a minute. So once I get the flow of blood established, I can remove the tourniquet. I just wait. This hand is locked in place, and I'm going to push off with my thumb to disengage this tube. Flip it the proper number of times, and reach down and grab my last one. Okay. Now there's some blood coming here. And I wait until that is done. I take it off, invert it the correct number of times, set it down. My tourniquet is already off, remember, and I'm going to take my gauze and I'm going to put it on the, like on this, just gentle pressure as I withdraw that out. Okay. So at this point, I am going to just reach down with my thumb and click that into place, and that's the safety guard. That whole unit gets thrown in sharps. Okay, so if I had a piece of tape or a Band-Aid, I would put that on the patient. The patient seems to be okay. And now I'm going to take my tubes and I'm going to label them. So I know that, I guess I could show you this. The label has a name and an MRN. And see how it says 6 ml serum tube? On your label here, it says serum tube right at the top. I don't know if that zooms in or you can see that. Okay, so tubes are labeled this way. You hold the color, so hold this part, the color, and the label goes on kind of right to left. Okay, and you just put it on like this, because in the lab the tube sits in the machine this way, and it therefore can then read the barcode. Okay, so you hold the label in your left and then it dresses itself. You put the label on so it dresses like that. Okay, so that is what we call a straight draw with, and that was a multi-sample. I took several tubes. Once the tubes are labeled, I would then put them in a specimen bag and send them off to lab, okay, and then await the result. But we're not doing that today. So the second type of blood draw that I can do is the butterfly. Okay, so it's called a vacutainer. Turn it around here so you can see it. It's similar, but there's a huge difference between the two. The gauge is much smaller. In the straight draw that I did, I had no idea if I was in the vein or not until I engaged the tube. And once I put the tube on and the blood came, I knew I was in the right spot. This has kind of got instant gratification. It's kind of instantly. When you're in the vein, it will show up in right here in the tube. Now, I don't know if you can see that in the video. I hope that's what works. So it looks like so. Again, there's a bevel to it. It's a smaller gauged needle. And then this is no different than the needle before. I'm just going to connect that to my vacutainer holder. Okay, so now this unit is my blood draw unit. There's a little bit more rope to it. Okay, so there's a concept that I'm going to explain about this rope. I guess I may as well do it now. Is in the order of the draw, this is really important. If I use the butterfly and I need to draw a blue tube, the additive that's in the blue tube for coagulation, it has to be exact. So the ratio of blood obtained to blood in the tube has to be exact or the test is not right. So therefore there's this little guy here and it's kind of like a clear topped tube, and this is called a waste tube. Because if I get the blood sample, I poke the patient and I get the blood sample and I engage the blue tube on here, the tube will fill up with all this air first before the blood gets to the tube. So the ratio is off. So in a draw with a butterfly and a blue tube, and just the blue tube, you need to have a waste tube, okay? So we'll maybe review that concept in lab so that you kind of get it. But I'm just going to show you the technique of the butterfly draw. So no different. Patient's prepped, my hands are washed, blue gloves. I have cleansed the site. I know where I'm going. I removed the tourniquet. I have prepped the site. So I'm just going to kind of skip all that part. And now I'm ready to go. So my gloves are on. I have my butterfly. I have found the bevel. I have my tubes. And I am going to, I've pinched up those handles so I can hold them better control. And I am going to poke the patient, okay? And when I let go, I hope you can see that. But right in this yellow section, right here, I have blood. I can see the blood. It's here. I know I'm in the vein. So I'm just going to kind of flatten out or hold the vein, or if I press down like this, it could pop the needle up against the vein. So I'm cautious. So I tend to hold mine either by the wing or by the yellow somewhere so that it's not over manipulated. And with this other hand, I kind of scoop and get, that's kind of low, it's hard for you to see, but I kind of scoop it up, and now I'm going to engage the tube. And see how the blood came up the tube? And now it's going in the tube, okay? No different. My left hand never moves. When this tube is full and the suction is done and it's gone, I can pop that off with one hand, move it around, pick up the next. So I can get multi-sample off of this guy too, the butterfly. Okay, so when he's full, I disengage him, but see how this hand never moves? And I prefer to hold on to it. That's my preference, is I prefer to hang on to the butterfly. You will see variations in clinical, but when you guys are starting, my suggestion is that you hang on to the butterfly. So when the suction is over, I'm going to take it and invert it. And the tourniquet should be on for no longer than a minute, okay? So I may or may not, I'm going to take that out, may or may not be able to draw the tubes with the tourniquet on in a minute. Or if I can't, whenever you establish the flow of blood, the very first tube, you could take that off. Now I was talking there and forgot to take it off. At the end of the butterfly, when you're all said and done, you want to slide up that yellow sheath and lock it in place. and then that's safety, and then that goes directly into sharps. Again, we would label the tubes the identical way. So the patient is good, he's not bleeding. I've inverted all the tubes. Remember again, I hold the color in my left hand and I hang on to this and I put it so that it kind of reads like a book, right? Right to left. Put it on so when it sits in the machine, it can read the barcode. Okay? And that's two techniques, straight draw with a straight needle and a butterfly draw. And it is recommended, get down here where I can see you, it is recommended that when you do a blood draw, the choice or what's recommended is the straight draw before a butterfly draw. We have posted lots of readings. We have used the health PEI policy. There's a phlebotomy basics reading. There's lots of great information in those. Please read them. Please go through the PowerPoint. We're going to cover a lot more of the importance that this was only really about technique. I hope that helps.